So, Andre, you recently held listening sessions within the LGBTQ community about COVID vaccinations. Why did you choose to do that?
So we had our initial sessions back in the fall of 2020 when we were in the midst of the pandemic. And we wanted to work to find out why people were hesitant or potentially hesitant at that time to take the vaccination. And so we worked with UNLV School of Public Health to put on these listening sessions to find out from the LGBTQ community how they felt about COVID, the pandemic, vaccinations, so we can ensure the messaging was on point so people could get the resources that they need.
And I say recently because you held them up until just about a month ago.
That's right. So now that things have changed a little bit with COVID, we wanted to have a listening session that was focused specifically on hesitancy to find out why people were potentially hesitant for getting vaccinated. And so we learned that people were hesitant really because of misconceptions about vaccinations in general, maybe pressure from family members, because we are a group of people in general that want to make sure that we are not upsetting our group. And so if you are one person that wants to get vaccinated but your family and friends don't, then that can have an impact. And so we just learned things like that so we can change our messaging when we are out in the community trying to encourage people to continue to get vaccinated.
And the misinformation or the misunderstanding about vaccines and maybe family members pressuring you not to, that's an issue that applies to everybody, not just the LGBTQ community.
Exactly. Often when we talk about these issues, it's regardless of someone's sexual orientation and gender identity. However, our sexual orientation and gender identity sometimes compounds things. And so we want to make sure that people aren't not only getting misinformation in general, but then also aren't internalizing these messages as it relates to their identity and how they might navigate accessing healthcare.
Compounds it, how so?
So if you are hesitant in general about, let's say, the vaccine because of what people are telling you, then you might say, well, maybe that's not for me. But then if you think, well, if I go to a healthcare provider and there is a risk of discrimination and harassment while I'm there or not being treated properly simply because of my sexual orientation or gender identity or the perception of it, then do I want to take that on as well as I'm already trying to find out, is this the path I want to go? And then do I also want to have the risk of discrimination as a result? And that's especially so for people who are transgender or gender variant.
And I thought it was interesting that you wanted to pursue finding out why there was hesitancy when you think about, according to U.S. News and World Report, estimates published by the CDC show gay or lesbian adults overall have had higher vaccination rates against COVID-19 compared with straight people. Why those high vaccination rates?
So one thing I can speak to is for gay bisexual men. So even when we did our initial listening sessions back in October, or fall of 2020, we found out that people felt comfortable with going through contact tracing. And because we historically have been going through contact tracing as it relates to sexual transmitted infections and HIV. And so gay and bisexual men are used to going to get tested. And if there is a possibility of being positive for HIV, going through the process of finding out who your sexual partners have been and giving that information out. And so it's something that we're used to in our community, unfortunately. And so when contact tracing was a thing for COVID-19, we're like, okay, let's do it.
All right. And then it extended to vaccinations as well.
Yep, absolutely.
How do you apply what you took from the listening sessions into messaging about monkeypox?
So although there are two different things, it's still a public health concern. We are probably going to do more listening sessions that are monkeypox specific. And so we know that we need to get information out there. It has to not have stigmatizing language, that even if we get information out there, is the public health system even ready for the onslaught of people to try to get vaccinated? Because if you try to get vaccinated and you're getting turned away or someone's website doesn't work, you're going to be frustrated. So then when things are up and running, it's 3 weeks later and maybe you've come down with monkeypox, maybe you are just tired and don't have time anymore. And so we try to make sure that our systems are ready in advance. And the rates of monkeypox are growing here in southern Nevada specifically. And so there's fear that it might be too late for the spread to stop. So this might become endemic within the gay and bisexual men who have sex with men community, which would be devastating.
It is interesting what you said about how are you going to go about with messaging for vaccines when the availability of them is semi-low at the moment.
Yep, there's confusion about who's eligible. There is misinformation about where to go and how to go about getting a vaccination. And so these are the things that we have to be mindful of. And so we recently got our website up and running, and we are going to start doing a social media push. But we're also talking to the State Department of Public Health to talk about what they're doing and how we can partner with them to get messaging out there and see what funds are available. So we are not only trying to take approach in the community, but also advocate within the administration to make sure that things are in place and ready to go.
It's difficult because anybody can get monkeypox, but the people that are at highest risk, according to the World Health Organization, are men who have sex with men. How do you change your messaging so that you're not promoting the stigmatization? Already there are reports of monkeypox being used as anti-gay rhetoric similar to AIDS in the 80s.
Yeah, so there's two paths, if you will. There's the idea that you don't want to talk about monkeypox in the vein that it's solely affecting gay and bisexual men who have sex with men, but also you can say that it's stigmatizing if you don't talk about it, because it is actually happening. And it just happens to be this community, this network of community of people who are transmitting the virus at the moment, but that doesn't mean that it's going to stay that way. And the more we learn about monkeypox in its current iteration, the better we'll be. But physicians, public health authorities did not have a good sense of what monkeypox was in general, and they only knew about monkeypox as it relates to in Africa, and West and Central Africa. And so the virus plays out differently now. And so when folks are going to months ago when people were going to their doctor about concerns, they were being turned away because people didn't think it was monkeypox. And then people also didn't know that it was either sexually transmitted or sexually transmittable or even adjacent to monkeypox. So when people were showing up to their healthcare providers, again, they were being turned away. And so as this is happening, the virus is spreading, and as it spreads, it's reaching more people, and our systems aren't ready to respond quickly to these sorts of things.
Sounds like you have quite the challenge ahead of you.
Unfortunately, we do, but we're on it. We're trying to reach out to our partners and officials with the health departments and again with the state to make sure that we can play a part, because it's not a time to point fingers and place blame. We just really want to help things out.
Andre Wade, Silver State Equality State Director, thank you for your time.
Oh, you're welcome. Thank you.